My name is Chandani Rathod, and in this presentation, I will be discussing my business plan to be a neonatal nurse practitioner. For workplace setting, my dream is to work in a children's hospital, such as Children's Medical Center in Dallas. Children's Medical Center is a renowned healthcare facility in Dallas, offering comprehensive care for neonatal and pediatric populations. The hospital is recognized as a neonatal center of excellence and is affiliated with the esteemed UT Southwestern academic healthcare system. The Level 4 NICU is equipped with 47 beds, is staffed by a dedicated team of 52 providers, and offers specialized care for over 650 babies annually without the need for external referrals, as they provide all services in-house. Children's Medical Center has the capacity to handle a variety of conditions, from common issues like respiratory distress syndrome and jaundice to complex cases like esophageal atresia and various intestinal disorders. The NICU has a diverse team, including nurses, nurse practitioners, respiratory therapists, pharmacists, dietitians, social workers, child life specialists, and therapists. They're also capable of handling special procedures such as ECMO and exit. They utilize advanced technologies such as NICView, which allows parents to view their babies via a camera during designated viewing times, and TeleNICU, which is a telemedicine program that enables healthcare providers to remotely assess newborns in regional hospitals, reducing the need to transfer infants to Dallas and allowing them to receive care close to home. In Dallas, Texas, with a population of 1.3 million and a median household income of $58,231, the 17.7% poverty rate significantly impacts neonatal health. This economic backdrop often results in reduced access to quality prenatal and neonatal care, particularly for low-income families. A substantial portion of the population likely relies on Medicaid, influencing both healthcare availability and hospital reimbursement strategies. On this slide are three CPT codes that are commonly used for newborn services. CPT code 99477 is for the initial hospital care for neonates that are not critically ill. CPT code 99468 is used for the initial day of critical care for critically ill neonates. And then lastly, code 99469 is used for subsequent days of critical care for critically ill neonates. Services that fall under these codes are cardiac and respiratory monitoring, vital sign monitoring, nutritional adjustments, laboratory and oxygen monitoring, and constant observation by the healthcare team under physician supervision. For this patient population, I estimated that 55% of reimbursement comes from Medicaid, 40% comes from private insurance, and 5% comes from Medicare. The reimbursement rate for Medicaid is 92% for nurse practitioners, and then for private insurance and Medicare, it is 85%. As you can see on this slide, the nurse practitioner reimbursement is stated for each of the three CPT codes previously mentioned. Here is what a sample day in the NICU could look like as a neonatal nurse practitioner. I estimated that I would see on average 10 patients per day. I might see 5 patients that are not critically ill but still require constant observation, 1 patient that is admitted critically ill, and then about 4 critically ill neonates that are being cared for on subsequent days. So what I did was estimate the physician reimbursement amount per day, which is $4,140, and then the amount for 1 year, which is $1,511,402. I then used this number to calculate the estimated nurse practitioner billing per year by multiplying it by the nurse practitioner reimbursement rate and by the percentage of Medicaid, Medicare, and private insurance revenue. After taking into account bad debt, salary, and benefits, the total facility revenue contributed by the nurse practitioner is $1,066,093. In my employment contract, some items that I want included are malpractice insurance coverage, continuing education allowance, PTO, reasonable work hours, and to be paid on an hourly basis. Occurrence insurance will provide ample coverage as it covers any incident that occurs while I'm insured. I want an allowance of up to $4,000 a year for continuing education, 4 weeks paid vacation, and 5 days sick leave. As for work hours, I would like to work 3 12-hour shifts a week during the day shift and to be on call for 1 weekend only. Based on the average salary for neonatal nurse practitioners in Dallas, I would like my base pay to be $65.44 an hour. In order to be a neonatal nurse practitioner, I must graduate from an accredited NNP program, such as the one that Baylor University offers. I will then obtain my NNP BC certification from the National Certification Corporation. It is my responsibility to maintain my NRP, BLS, and PALS certifications for advanced care life support. Through my collaborative contract, I will obtain prescriptive authority as well as obtaining a DEA number in order to prescribe controlled substances. Scope of practice. APRNs practice in various healthcare settings and offer a wide range of healthcare services according to their authorized role and population focus area. The setting in which I will be working in is a level 4 NICU in a hospital. APRNs can perform actions within their authorized scope consistent with the Nursing Practice Act, Texas Board of Nursing rules, and relevant state laws. Factors considered for scope determination include education, standards of care, clinical competence, credentialing, and additional post-licensure training. If additional training is required, it should meet specific criteria including type, objectives, content, length, provider qualifications, and evidence-based practice alignment. Training should be certified or recognized by professional specialty organizations. The APRN must demonstrate objective, verifiable competency following training completion and maintain records of completed training and competencies. Nurse practitioners are not prohibited from providing nursing care within the registered nurse's scope of practice. Lastly, any actions performed outside an APRN's authorized scope may lead to disciplinary action. Here are some specific duties that I will be performing as a NNP. Collecting a detailed maternal, obstetric, and newborn history, performing physical assessments according to gestational age, ordering, performing, and interpreting diagnostic tests, assessing the need for respiratory support and intervening accordingly. Whether or not I can intubate patients depends on the facility policy. Some more duties include line placement such as a UVC or a UAC, writing orders based on the infant status and plan of care, newborn resuscitation if needed, ensuring proper feeding, educating and updating families, and of course collaborating with an interdisciplinary team consisting of neonatologists, respiratory therapists, speech therapists, occupational therapists, and more. So the collaborative agreement, prescriptive authority agreement is between the nurse practitioner and a collaborating physician, and it must be in writing and signed by both parties. This agreement must specify the nature of the practice, practice locations, and practice settings. It should identify the types or categories of drugs and devices that the nurse practitioner is authorized to order or prescribe or specify the types or categories that may not be ordered or prescribed. So for in Texas, I would need a delegation agreement with my collaborating physician in order to prescribe Schedule II drugs. The agreement should outline a general plan for addressing consultation and referral of patients. The agreement should state the general process for communication and information sharing between the nurse practitioner and the collaborating physician. For me, I would like this to occur daily and with the doctor or the collaborating physician available 24/7 given the critical nature of the NICU. And then these meetings can occur in person or virtually. For the quality assurance plan, a prescriptive authority quality assurance and improvement plan should be described and should include chart review and the periodic meetings between the nurse practitioner and collaborating physician. And these meetings will occur monthly. It is my responsibility to complete continuing education in pharmacotherapeutics for licensure renewal. Any APRN who holds prescriptive authority must complete at least 5 additional contact hours of continuing education in pharmacotherapeutics before the end of every licensing period, and these 5 hours are in addition to the 20 contact hours required for all nurses. Assessment and evaluation. I would like the frequency of my assessment and evaluation to be done bi-weekly for the first 6 months and then on a monthly basis. I would like it to be done bi-weekly because as a new graduate nurse practitioner, I want to make sure that I'm on the right track in meeting all of the objectives as well as making sure that I'm serving my patients to the best of my ability. And then this will be done with the collaborating physician. The outcomes that I would like my performance to be based on are NICU readmissions, patient ratings, and peer reviews. The patient ratings can be surveys that are sent out to families after discharge or based on online reviews. And here are my reviews. Thank you for your time.